Now on to community readiness. So we're going to be using the community readiness model as I described, which was created by the Triethnic Center out of Colorado State University. If you want, while I go through this section, you could pull up their guide. It's really wonderful and talks about in piecemeal some of these various sectors that I'll go through, but I'll just give an overview of what the community readiness model is. So community readiness is this idea to identify the degree to which a community is willing and prepared to take action on an issue. And when you are assessing this readiness, you're considering some of these key components, which include a set of survey questions. You would do a key respondent interview and then score that interview based on the 5 dimensions that we'll go over, and then use that score in designing your final plan of action. So the community readiness model is very much about big ideas. And so we're going to be modifying it a little bit just so that it fits within what we're talking about, which is, we're focusing on the community's readiness to receive the adaptation action. So with that in mind. So the community readiness model is really measuring both the community and the leaders' attitudes, efforts, and activities, their knowledge, and their resources. And so these are distilled into these dimensions of community knowledge of efforts, community knowledge of the issue, the community climate, leadership, and resources. And so in the document that you might be scrolling through right now, they have descriptions that map to each of these dimensions. And so, as I said, this idea of the community readiness model is really about like big change. And while some of the work that you would be doing in adaptation for health and implementing your adaptation actions might be big change, these questions don't map exactly the way that we would want to, so I modified them a little bit. So they're just modified so that they're consistent with thinking about our adaptation actions. So as you would go through and thinking about your community's readiness on these dimensions, you would ask yourself these questions. So related to community knowledge of the issue, how aware is your community around a specific climate and health outcome? Community climate or priorities. So what are the community members' attitudes towards the climate and health outcome and the adaptation action? So really thinking about where they're coming from with respect to the exposure and maybe what you're going to try to do about the exposure and the outcome. And for the leadership dimension, we're asking ourselves, what are the community leaders' attitudes towards the climate and health outcome and the paired adaptation action? Community knowledge of efforts is asking how much the community knows about the planned and current programs and activities that are around or focused on the climate and health outcome that's been identified. And then lastly, for resources, we're asking what are the resources that are being used or could be used to receive the adaptation action. So with the community readiness model, the way that you go through doing this is you would have your key informant interviews, you'd organize them by those dimensions, and then you would score those dimensions based on these 9 stages of readiness. And so in that document that's on the website, there's a lot of examples and descriptions on what each of these stages mean. So I encourage you to look at them, but you can see that they range from absolutely no awareness, so it's like the climate change is not real, it's not happening, to community ownership, which is this is our problem, this is our issue, it is happening now, we have to take this, and we've already started on it. So you can move between these stages of readiness based on a whole host of things. Oftentimes, certain events can escalate where you are on readiness. So for instance, the wildfires in California and out west in the summer of 2018 have been some of the worst. So those might raise the awareness and actually push people and push organizations and communities to the point where they say, we are ready to handle and take this on because we can't have another example or another summer like that. So let's get into an example of what that looks like when we're talking about community readiness. So the Vietnamese Mekong Delta is identified as a region in the world that's most at risk to the impacts of climate change, and just one of those risks is sea level rise. So they're expecting and seeing a lot of saltwater intrusion, a lot of flooding, which happens naturally there, but is happening in far larger magnitude and frequency, and then concerns around food security. And so in this example that we're going to see, which was born out of a project that was federally funded, the community is the researchers were assessing the community's readiness for two different options. The options were to relocate to a completely different area or to elevate their homes. And so you could see here that the researchers, they did some key informant interviews, and they asked questions about these two options, so either to relocate or to increase or to elevate their homes. And they assessed them on these decision-making criteria that they have. So these don't map exactly to what we saw with the community readiness model, but these are relevant areas that the researchers found needed to be assessed in response to what the community was talking about. So these criteria that were assessed were longevity, the co-benefits or the trade-offs, the cultural acceptance, what some of the alternatives to those options were, what the cost was, your knowledge needs, how it's going to impact these communities' livelihood, how long it's going to take, and what's required to implement this, and some of the barriers and opportunities associated with it, as well as the environmental impact. And so what's really interesting is, and you can see here on this graph, perhaps not as clearly as you would like, but the researchers actually found that 90% of the households that did this survey viewed elevating their homes as a positive option. And about 70% of the people who responded to this survey saw the relocation option as mostly negative. So you can see that this group is more interested in elevating their homes than they are to relocate. And oftentimes it's really hard to see some of those numerical or categorical examples really rise to the surface. So here we're just seeing a pro-con list, which we all make often. Maybe I do a lot. I make pro-con lists a lot. So you can see a pro-con list of raising your home versus moving. So on the left, one of the positives of raising the homes, it might provide long-term protection, but it doesn't address the issue of the problem. And also, in this example, it wasn't allowed by the local government. So that's a huge barrier. Another positive for this was it might improve your living conditions, but on the other hand, it's only temporary. For the moving examples, I thought it was really interesting to note that one of the positives for moving would be that it could increase it might increase their household income. But on the other hand, this less tangible thing to quantify or to measure is this idea that these communities might be afraid to start over new in a completely different location. Similarly, a positive is that this is a quick solution. If you move, you have extricated yourself from that risk. But you might not want to give up your ancestral land if that's where your culture and your value and your heritage is important to you. This might be something that makes it really hard. So thinking about the community readiness is really important, and you can do this in a variety of ways, and the community readiness model is one of them. So with community readiness, just to reiterate, the focus is on the recipient of the action, the community. It's important to think that think about it like this. Communities are like individuals. It happens. Like, they can undergo activities and they might not think about readiness until they're at a place where they realize they should have thought about readiness. So we encourage you to think about this from the beginning. And you also might think about what are some of the features of your community that you should consider before implementing, those things that don't necessarily fall into one of those dimensions that you have. These are flexible readiness models that you can adopt for yourself, but it's important to know and to think about it because, as I mentioned with the implementation readiness, your readiness will drive your adaptation action design.